I need to agree that you did email me about it.
Yes.
That I will sign.
Yes, me the second. She's like,
And he's also being the secretary.
I was like,
So it means about 5.
yeah, I have a great time.
You what it says? Annual haircut.
Yeah, it's about right. I sent a picture, and it was like the guy was like, just had a little myself. I just got back from the cost cutter for my
For your poodle cut.
yeah, why wouldn't you? When it's like two below, you're like, yeah, let's shave all
I mean,
that.
we were going for a couple of months, you'd have to go in again.
I knew the person doing it too, and she was very chatty. I was like,
Oh, everything got real quiet. Maybe I should do a thing. All right, is the camera on? Okay, thank you. I'd like to call this Board of Health monthly meeting to order for Wednesday, January 8th, 5 p.m. Could you please call the roll?
Danielle Chenoweth.
Here.
Kyle Patterson.
Here.
Jennifer Locke.
here.
I just want to welcome Jennifer as our new board member. Thank you for joining us. Approval of the agenda. Can I'd entertain a motion?
So moved.
Second.
A motion is second. Any discussion? If not, all those in favor say aye.
Aye.
Opposed? That carries. Next, we have approval of minutes of the previous meeting for November 13th, 2024 as monthly meeting. Since you weren't present, I'll go ahead and make a motion to approve that.
Second.
We have a motion and a second. Any discussion? All those in favor say aye.
Aye.
Aye. Opposed? That carries. Public participation. Is there anyone here who would like to speak to the Board of Health? Okay. Seeing no public participation, correspondence?
No, I don't have anything in particular.
Okay. I would like to call in myself, if you wouldn't mind. I'll pass it to you. I just want to thank Public Health for helping us open the Public Health Winter Emergency Shelter. It is not something that we wanted to do. It's not something that we expected to do. We were hoping that by moving 41 people out of strides, by moving 20 people out of strides using a program that Cunningham Township was able to be funded for, that would be sufficient. But we did that, and we still had folks who were sleeping outside. As the winter months as it got closer to the winter, we did a census of families and individuals outside. It was 17 families outside, and it was 50 or more. 50 is possibly conservative, 50 to 80 individuals sleeping outside. So moving 20 people out of strides was not going to be sufficient to address that. And that's when I had a conversation with Julie, and I was like, it's kind of game on at this point. Like, there's a lot of different things we attempted to do, fill all beds that we had, and we did that with the exception of Salvation Army. Someone should give them a call. And then we were also able to, open up 20 more beds, and we were able to move folks out of the community who maybe had friends and family in other communities. So we tried all of those things. We did all of those things. We know from the HUD report that just came out, there was an 18% increase in homelessness last year across the nation. The homeless rate for families was up by 39%. That is also consistent with what we've seen here locally. We've seen more people homeless with a specific emphasis on families. So I know that it's difficult to give up your break room, and I know it's difficult for you to add another thing to your busy schedules, and to navigate that. And I just want to appreciate Public Health for stepping up to the plate in doing that. And by doing it, you saved lives. Last year, we had people lose fingers who were sleeping outside. They lost toes. And I don't know, because the coroner doesn't track it, let's fix that, that whether or not people died because of exposure and homelessness. They're supposed to provide a report every year, and that has not yet been tracked. Maybe something to track with the I-plan. So with that,
She's the county board chair.
oh, you're the county board chair.
I got
Sorry, looking at you.
I got it.
Okay, sorry, Kyle, it's a habit. So
No, I didn't
Julie,
think about it.
thank you. Jim, I wanted to thank you. I particularly want to call out Jim because the meeting that we had in the back when we were getting ready to expand that space for shelter, Jim's like, what do you need? We'll put a wall here, we'll change the alarm there. I got Band-Aids, I got cots. And it was like, I just really felt like I was in the presence of a team player. And I really appreciate you for jumping in. It's clear that public health is mission driven. And then I also heard that Rob and Lauren were both behind the scenes support. Are either of them here? Okay. Rob, can I present you card, please?
Speech. Rob and Lauren did the cots and
And
the
then
figuring out how
Lauren,
to
or someone
put
can
them
take
in.
this on behalf of Lauren.
Rob can.
Rob is
Could you
Lauren.
please give
Yes,
that to
of
Lauren?
course, yes.
These are just thank you cards. Because of COVID, I didn't lick them, so there you go. Just wanted to thank you, and I wanted to thank the whole staff, all the department heads, finance, you know, all the people who hold the pieces together where it isn't always obvious and your work is not always clear in the impact. So, thank you. I look forward to us continuing to level up our homeless services. We know that we're anticipating cuts in homeless funding, especially under the Trump administration. And so we're gonna, it's just like a pandemic, y'all. We have to weather the storm together and hold hands. So after we wash them and, that we wash after. So anyway, I just want to thank Public Health for your service. And Julie, I want to thank you for your leadership. Any other correspondence? Okay, if not, I don't see any old business. Moving on to new business is the election of the secretary. After speaking with Jennifer Locke, who's our newest member, I would like to nominate you as our board secretary to replace our outgoing secretary.
I accept.
Okay, I have an acceptance. So that would be my motion. Do I have a second?
I don't think you need one.
You don't need a second on election of the secretary?
I don't think so.
Don't you have to take a vote?
Yeah, vote.
Oh, okay. We have a nomination and acceptance. Don't need to.
There's no other nominations and.
Okay. Any other nominations? Somebody want to nominate Kyle? Okay. And now I close the nominations. Okay, all those in favor of Jennifer Locke as secretary, please say aye.
Aye.
All those opposed, that is 3 ayes and carries.
It was pretty loud, Kyle.
Yeah, next we have the treasurer's report from Ron Fields.
Yeah, I've got 2 months. I'll go through the first one fairly quickly. First one was the end of September 2024. We had cash on hand of $8.7 million with a total fund balance of $7.7 million, representing 46% of the budgeted expenditures for the year. We ended that third fiscal month with a deficit of $100,966. Total revenue was $3.6 million, which is $432,000 under the year-to-date budget, mostly due to contracts and revenues under budget by $311,000, fee-for-service under year-to-date budget by $154,000. Our total expenditures through the third month was $3.5 million, which is $776,000 under the year-to-date budget, mainly due to personnel being under budgeted by $343,000, fringe benefits by $197,000, and capital outlay under budget by $209,000. For the end of October, we had cash on hand of $8,161,218. Our total fund balance was $7.8 million, which is 46% of the budget expenditures, same as the previous month. We ended that month with a surplus of $159,348. Total revenue was $4,767,942, which is $588,797 under the year-to-date budget. Our total expenditures for the end of the fourth month was $4,608,594, which is $1,107,042 under the year-to-date budget.
Any questions for Ron? If not, we'll go ahead and move on to, actually, yeah, so treasurer's report. There's approval of payments to Board of Health appointees. Can I do these in an omnibus fashion, or do I have to do them by?
I see no reason why you cannot do them in omnibus.
Okay, so prepare for a very long-winded statement. I would like to move approval of payments to Board of Health appointees for Treasurer Ron Fields for November 2025 for services, Administrator Julie Pride for mileage to the emergency response training November 8th of last year in Springfield, and for mileage to the IPHA conference November 19th in Springfield, and for mileage to the IPHA conference November 20th in Springfield, and for the IAPHA meeting November 22nd in Pontiac, and also for mileage to emergency preparedness training December 18th in Springfield, and for mileage to the emergency preparedness training December 19th in Springfield. Geez, you've been really busy. And then to Attorney Ruth Wyman for legal services for 2 different months, September to October, September 16th to October 15th, and for November 16th to December 15th. I made a motion.
Second.
A motion and a second. And Ruth, did you get paid for October through November?
I think I did get paid.
Yeah.
Yeah,
Okay,
I
all
think,
right.
so,
That's what I was just gonna say, is that,
so, and we did a correction, you'll see in the packet,
Mhm.
there was a correction on that. But I think that takes care of everything. I'll certainly, I do billing on the 15th of the month and send that out. So sometimes you'll see that there's an amount paid that's different than the amount due, and that's because the check that was issued and voted on by the board came after the billing statement was sent out.
Okay,
So, but
that
it
makes
was
sense.
good.
You and Anne are in. Okay. Great, I have a motion and a second, and this other discussion. All those in favor say aye.
Aye.
Aye. Opposed? That omnibus motion carries. Next, we have a review of the monthly credit card statements. I don't think there's any action, just questions. Any questions? Okay, next we have approval of the 2025 Board of Health meeting schedule. And I was trying to look and see, did the time change at all, or is it the same? You know, the main schedule.
I think it still says 5.
Still, it's 5 on Wednesdays. Okay, cool. Approval of the Board of Health meeting schedule, I'd entertain a motion.
So, second.
I have a motion and a second, any discussion? If not, all those in favor say aye.
Aye.
Those opposed, that carries. Next, we have approval of affiliation agreement between Parkview College and CUPHD. I would entertain a motion.
So moved.
Second.
A motion is second, any discussion? All those in favor say aye.
Aye.
Those opposed, that carries. Next, we have approval of job descriptions. We'll start with the I-plan specialist, so entertain a motion.
So moved.
Second.
A motion and a second. Any discussion? Real quick, can just, the last I heard, the I-plan used to be led by here it is. It used to be led by Carl? No, it's
No.
always been led by us?
No, so here's how it worked. We did it for years, because the I-plan is a public health department
Yeah.
rule, we have to do it, it's mandate.
Yep.
So what we did was, I don't know, 10 or more years ago, we partnered with Carl and OSF, and then brought in, or whatever OSF was back then, and then brought in mental health. Who else did we bring in? United Way, it was being the lead agent. So we all worked together, we all put money in, and we hired a person. The person was actually working they worked out of here, but they were working for United Way. So
Mhm.
what happened is, once the hospitals, I won't say that, but anyway, the hospitals have decided that they no longer want to do this.
They don't want to participate in the
They
I-plan.
don't, because, they just don't want to. So we're taking it back, and it's all gonna be I-plan. So
Will they
it'll be
participate
us.
in some way?
They'll participate, but so they have to do one because they're not-for-profit.
So they'll just do a separate iPlan instead of us doing it together.
They'll do a
they'll be
community assessment, which is something that is literally just used by the hospital. I don't know that they're used by the hospitals, but it's something they do. They'll do their thing, and we will do a true, we're already, since getting staff trained up to do MAP 2.0, which is the higher level. We use the highest level already, the MAP process. So, long story short, it's coming back to where it belongs, and we will have a lot of community partnerships. However, Carl and OSF will no longer be making any decisions
Okay.
related to it, and that's a good thing, because their goals and their things are different than ours, so it's a good thing.
And what, does it guide, if it's just us, does it guide our expenditures, or does it
No.
guide something else?
Here's what an I-plan is supposed to do. We're supposed to do a community assessment, we're supposed to say, these are the issues that need to be addressed. And then in a perfect world, all of the funders would say, these are issues that need to be addressed. So when they go to do funding, they would focus their funding on those things so that we could
Yep.
get it dealt with. And it would be, it's not a disease necessarily.
Yeah.
I mean, it can be obviously homeless, the homeless situation, the lack of affordable housing, that can certainly be one. We have access to care has been one forever, and then it got better under the Affordable Care Act. And then, so right now, it's healthy living, it's, what are our three things? Violence prevention, which is that it's run by, they're not a technical part of it, but the community coalition and all the different groups are kind of like leading that.
Yeah.
So that's the goal, and then what we will do at Public Health is we'll pick up the stats and stuff, and we will monitor those, and we will be putting those out on a community-facing platform, so people will be able to always keep up with those things, get those stats, use them for grant writing and whatever. But the real goal behind an I-plan is that the community comes together and we pull on the rope the same way, doing the same thing, and then funding. In a perfect world, the hospitals push money toward those things,
Yep.
whether they're part of the process or not, but it doesn't always
Doesn't
work.
really happen. And then the I-plan specialist, do they then coordinate, or who is coordinating the I-plan process?
Currently, it's J.R. Lil, who
Okay.
works in our offices, but he is, until the end of this, is employed by United Way.
Okay,
So,
and he'll continue to,
well, he'll apply for it.
He'll apply for it, I see.
Hopefully he will,
okay, got
since
it.
we've been training him up on
Okay, got
MAP
it.
2.0.
Okay.
Hopefully he will, but yeah, that's the idea behind it. So it's not gonna really look any different to other people. It'll
Okay.
look different behind the scenes, and
Yeah.
our meetings will be different, but
Okay.
other than that,
Yeah.
it'll look the same.
I would say I pull data from the I-plan in every presentation that I give.
Well,
I use the I-plan. It's been really helpful, and I
Wait
would
till
love this.
Metopio gets here.
What?
Wait till Metopio gets here, that's gonna be when is that starting?
There's no date yet.
Isn't
Working on it.
Metopia like our
It's
dashboard, our public facing dashboard?
Yep, it's
Okay.
gonna be the
Yeah.
public facing
I-
dashboard.
Great. I would just say it would be great for the board as ambassadors for public health to know when there's opportunities for public input on the I-plan, so just please keep us informed. Okay, any other, was there a motion and a second on this? I'm sorry.
No.
No, but
Okay.
can I just say that even if you weren't a part of the board, as township supervisors and county board chair, you should already be
Yeah.
involved in that process, so you'll
Yeah.
get invitation.
Yeah, I generally have interns who are producing reports on poverty and housing and discrimination, and I feel like that data, maybe we haven't effectively, helped connect that to the I-plan, and we'd like to, as well as to borrow from the data, so. Okay, so I am now gonna entertain a motion, because it sounds like I didn't yet, for the I-plan specialist.
So moved.
Second.
Okay, a motion is second, any discussion additionally? Okay, all those in favor, say aye.
Aye.
Aye. Opposed? That carries. Next, we have plan review specialist. I'm gonna entertain a motion.
So moved.
Second.
No motion, second, any discussion? All those in favor say aye.
Aye.
Opposed? That also carries. Next, we have the deputy administrator revised. I believe it was put out and now you're revising and putting out again.
Yes.
And so I'm just wondering if you could give a little description as to the I saw the changes, but what the
Sure.
meaning of the changes are.
Hang on a second. So we're working around the idea that we wanted to create a more diverse leadership team. So we were looking at the deputy administrator in that regard and working with Morna Geiler. She came up with this language that we added so that we could advertise and look for someone in that regard. So experience working with a culturally diverse workforce, either in a leadership capacity or as a member of a traditionally underrepresented cultural group was added. So we could get that language out there and let people know that's what we're looking for, is some diversity to add to our leadership, which we've talked about before, obviously.
We were having trouble, like, knowing how to write that.
Yeah, it's probably worth having a lawyer look at it, especially as Trump comes in route.
Right.
And DEI is under attack. I'd entertain a motion for approval. So moved.
Second.
Motion, a second, any additional questions? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of garden shed artwork and design commission agreement between Jose Vasquez, the artist, and a CUPHD with revised completion date of June 30th, 2025. I saw it was about $2,000 commission. I would entertain a motion.
So moved.
Second. We have a motion, a second, any discussion?
Well, I just want to tell you that what he did was actually meet with people who actually are out there working in the garden, and they are going to be on the thing.
That's okay.
It's crazy. When I saw the design, I was like, oh, God, he is amazing.
Yeah,
So,
if artists are in the world.
mhm.
Any other discussion? All those in favor say aye.
Aye.
Aye, opposed, that carries. Next, we have ratification of check request payable to Integrity Property Services for fiscal year 25, dash 006 upfront payment for hallway painting. So moved. Motion. Second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have ratification of check request payable to Champaign County Collector for, I'm gonna vomit on my words, Carl Foundation versus CUPHD 2008-L-020 property tax settlement.
Let's do it with a great big check and a public.
Yeah, but, yeah, and, hey,
They still count legally.
I say yes, please feel free to do that. It's quite a large check. And entertain a motion for this ratification of this vomitous check request.
So moved.
Second.
Okay, we have a motion and a second. Any discussion?
No.
Okay. All those in favor say aye.
Aye.
Opposed? That carries. Next, we have approval of check request payable to Tyler Technologies for enterprise permitting and licensing annual fee December 1st, 2024 to November 30th, 2025. Entertain a motion.
So moved.
Second.
Motion second, any discussion? If not, all those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of check request 2 of them payable to Tyler Technologies for project management and implementation consulting.
So moved.
Second.
Motion is second, any discussion? If not, all those in favor say aye.
Aye.
Aye. Opposed, that carries. Next, we have approval of check request payable to McCormick for HVAC demo and installation of new RTU, that means rooftop unit, in case you're wondering, number 506 for the MCH conference room.
So moved.
Second. Motion and a second, any discussion? If not, all those in favor say aye.
Aye.
Aye. Those opposed, that carries. Can I do the 3 tacked together?
I don't see why not.
Okay. I would like to move in omnibus fashion, approval of requisition payable to Gov Connection for Dell server, approval of requisition payable to Dell Technologies for new laptops, approval of requisition payable to Dell Technologies for Microsoft licenses. I think I'll stop there, those 3. And entertain a motion.
So moved.
Second.
You have a motion, a second, any discussion? If not, all those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of Apple Developer Program License Agreement and for the CUPHD IT network administrator to sign online. I'd entertain a motion.
So moved.
Second.
A motion and a second, any discussion? If not, all those in favor say aye.
Aye.
Aye. Opposed, that carries. Next, we have approval of agreement with Project Restore Initiative and check request payable for March 2025 training. I'd entertain a motion.
So moved.
I think this one has to, this one is the one, correct? Ruth, this one is not ready yet.
Okay, they were asking questions and making some modifications, the last email I looked at this afternoon.
So if you could, maybe if you'd be willing, approve it pending approval from Ruth. Because what she's doing is she had some questions, we're getting those questions answered by, were you in here, Rachel?
Yeah.
Oh, yeah, okay. You just see them.
Yeah.
Okay, yeah. Or is it ready?
I have a message into Project Restore Initiative to see if he can update the contract.
Yeah.
We do have the dates finalized, it just wasn't in the contract that he sent back in June. But we do have the dates finalized.
I'm not sure that we have to have, I mean, the question was just sort of how much time and how many meetings and things like that. And so I think it's best to have that in the contract, so you have that, and so, I think, yeah, pending, final approval and then, but the amounts are still the same, it's just some of the wording that is getting clarified,
Okay.
just so it's, yeah.
Okay, basically it's just date clarification, or are there others?
So it's just a clarification, like the number of meetings that will take place.
Okay.
The dollar amount is not expected to change at all.
Okay, and so we could do it pending,
I think pending language clarification, but that the amount as stated in the agreement will remain the same.
would it be language clarification by the attorney or by the administrator?
You could do it by the administrator and I'll advise her, but,
Okay.
because
We usually, in the past, we've always just said, approval pending legal.
Okay.
Or, approval by legal.
Okay, so
Because I want Ruth to go to jail, not me. It's not, it's really not that, it's not a big deal. It's just like she said, it's just
Here.
getting the language that was in emails and talked about actually into the
said
contract.
it was May,
so.
but it'll be June. Okay, so I would move approval of agreement with Project Restore Initiative and check request payable for March 2025 training, pending additional legal review to work out date and language changes with no change to the cost. That's my motion.
Second.
I have a motion, a second. All those in favor? Say aye. Opposed? That carries. Next, we have approval of check request payable to Kronos Sasher for workforce ready software from March 1st, 2025 to February 28th, 2026.
So moved.
Second.
A motion, a second. Any discussion? Not all those in favor say aye.
Aye.
Aye. Opposed? That carries. Next, we have approval of check request payable to Kessica for software February 13th, 2025 to February 12th, 2026. Entertain a motion.
So moved.
Second.
We have a motion, a second. Any discussion? All those in favor say aye. Aye.
Aye.
Opposed? That carries. Next, we have approval of Workforce Solutions Cooperative Acceptance Agreement for Janitorial Services with Cintas. I'd entertain a motion.
So moved.
Second.
A motion and a second. Is there any discussion? Just a quick question. I was trying to get to 203. Did we do a screening on Cintas for local minority? Is there a?
No, everybody we checked, they would supply or sell us materials, but this is the only firm that would actually monitor and come in and do that kind of work.
Is it specialty janitorial services?
Well, what it is instead of us having a large overhead and having to order stuff constantly, what they will come in every week and they will check what we have, and we will set an inventory level of paper towels, 2
I see.
cases, and they'll just make sure it's there. They
Okay.
also will set up a dispensary area for all the chemicals that are used
Okay.
so that the janitors are not overusing
I see.
product.
Okay.
And in the long run, it will save us money.
And so basically, they're the only ones you could locate that do the specific kind of
Specific
janitorial services.
Everybody else would sell us the
Okay.
stuff, same as
Okay.
Amazon and that, but we wanted someone to come and actually monitor this.
Okay. Yeah, I would just ask that they understand, be aware, if they're the ones making any kind of purchasing decisions about supplies, that they be aware of our priorities.
Correct.
Okay. Did I have a motion and a second for this?
Sure.
I did have one, okay. A motion and a second, any other discussion? If not, those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of check request payable to Circa for annual job postings.
So moved.
Second.
We have a motion and a second, any discussion? If not, all those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of check request payable to
Second.
Thank you, Sickich, for February 24 audit processing billing.
So moved.
Second.
We have a motion, a second, any discussion? If not, all those in favor say aye. Those opposed, that carries. Next, we have pending grants for the administrator to sign, which are here. I think we have to
Last
make a
page.
motion, right? So, I believe the motion is for to allow the administrator to sign a contract between CUPHD and Delta Dental for a pilot project that will implement application of silver diamide fluoride in our school-based dental program. Silver diamide fluoride is an antimicrobial liquid that is able to treat cavities in a non-invasive, fast, affordable, and painless manner. My son could use that. Okay. The amount is $14,358. And the contract period is January 1st, 2025 to December 31st, 2025. I'd entertain motion.
So moved.
So moved.
Motion and a second. Any discussion? If not, all those in favor can say aye.
Aye.
Those opposed?
Jennifer Boyd write that?
It's just the description of the grant.
I like it.
Next
Tell you
time
what
we
it
expect
is.
an actual demonstration.
And then our next meeting is February 12th at 5 p.m. If there's no further pending business, these.
No, stop it.
Daniel, I know